Hi, Dr. Dan here from Turo Family Chiropractic. I've been meaning to do this video for a while, but I wanted to share with you some shoulder strengthening exercises that I recommend to almost everyone, but specifically for people who have a shoulder challenge, if they had surgery and are recovering, if they had a shoulder injury and are recovering, or you're just looking to get stronger with your strength and stability for a sport like tennis or golf. These are some great exercises to do on a daily basis to help the strength and stability of the shoulder. Now the shoulder joint, okay, right through here, has one of the greatest ranges of motion than any other joint in the body. Now that comes with a caveat, because the greater freedom of range of motion that you have in a joint, the greater the chance of instability, breakdown, degeneration, and injury. So the whole purpose of these exercises is to really help strengthen and stabilize this shoulder joint. I always used to have chronic shoulder injuries and just nagging pain, especially in through the top part of the joint right through here. And it was because I was not balancing the exercises with my shoulders. So these couple exercises are going to help strengthen your shoulders and really help to alleviate some of that pain and instability that you're having, and allow you to to have a better overall quality of life because of the shoulder stability. So the first one, we're going to start off with a shoulder abduction, and you can do these one at a time or do them individually. But you're going to bring your shoulders straight out to the side, okay? Now you can do these with weights or without weights, but you're going to come up, just hold for a split second and then let them back down, okay? You can do this with a 5-pound weight, 10-pound weight. If you're 60, 70, 80 years old and are doing these exercises and you have some weak shoulders, you can start off by doing no weight at all, and just simply the weight of your arm will help to strengthen that muscle. So that's called shoulder abduction. And what that does is that hits the middle part of your deltoid. The deltoid has 3 parts to it: the middle, the front, which is called the anterior deltoid, and the back, which is the posterior deltoid. So this abduction, it hits the entire muscle, but it really helps to strengthen that middle deltoid, okay? So that's the first one. The next one that we're gonna do is shoulder extension. And you're going to come straight out, shoulder flexion, okay? And these are just front raises, or, it's also called in the fitness world. And you're just going to raise your shoulder straight out in front of you and hold for a split second and come right back down. So that's shoulder flexion, okay, and front raises. And again, you can do it one at a time or 2 at a time. Now, when you're doing that exercise, you can also turn your arm so you're doing more of a hammer hold, okay? So you can bring it straight out in front of you and hold it more in a hammer hold like this. So that's your front raise. And again, you can do it with your arm turned over, your hand facing down, or in a hammer hold with your arm facing like this. Okay, so that works the front or the anterior part of the shoulder. The last one for the deltoid strengthening is going to be your posterior. And this is one of the keys that a lot of people miss when they're strengthening their shoulders. There's a back part to this muscle, and that connects into a lot of the back part of the muscles where the shoulder meets the back muscles, and it really helps to hold your shoulders back in a neutral position. When you have shoulders that are rounded forward like this, and you see this with people who have overdeveloped chest muscles or who are getting weaker as they age and their head comes forward, these shoulders are rolled forward. It creates weakness and instability and leads to injury. So to work on the back part of that shoulder muscle and really get the shoulder in a neutral position, we've got to work the posterior shoulder muscle, and that's called posterior deltoid exercise. So you're going to bend forward just a little bit. I have a chair right here in front of me, so you can lean forward just like I am now. You want to keep your head and your back in a nice neutral position, okay? Kind of like this. And what you're going to do is you can bring that arm straight out to the side, okay? And so I'm doing it from both directions here, straight out to the side. You want to make sure your head and your spine are nice and neutral. And the further you lean over, the more you're going to get the back part of that shoulder. And you should feel it right across through here. Again, You can do it with weight, you can do it with 5, 10 pounds. It does not have to be a lot of weight. The idea is just to feel a really light muscle pull, a light burn through here, meaning that you're going to be working that muscle. So coming down just like this, again, straight out to the side. You want to try and keep that elbow as straight as possible. You can have a slight elbow bend, but you want to try and keep it as straight as possible. So just out to the side, just like that. Okay, so those are the 3 deltoid exercises that we like to have you do. The other one, and this one I usually like to start with, but this is one just to get the shoulder motion going. Again, I've got a chair right in front of me, so I'm leaning over a chair for some support. I'm letting my shoulder just relax and hang down here. And what I'm going to do is I'm going to do some small shoulder circles. This arm, notice my arm, it's not tight, okay? My shoulder is relaxed. I'm just going to let the weight of my arm hang down and do shoulder circles, okay? This is all the motion I'm doing right here, and then you can get wider, okay, as you're letting it hang down here, okay? So you let that shoulder, you start small circles, and then get bigger and bigger, and then you go the opposite direction, okay? This one is really, really good for someone who is recovering from an injury. You feel like you have, some sort of pain in there that it's very, very difficult to, to do some of the other motions that we did. So it's just enough to get that shoulder moving, okay? The last one that I really like people to do is it's a shoulder retraction. And again, this, like the posterior deltoid exercise that we did, this one right here, this helps to bring the shoulder blades back into a neutral position. So all it is you're going to hold your hands, okay, cross them right here. You're going to hold your head up in a nice neutral position so your ear is over your shoulder. And all you're going to do is you're going to squeeze the spine between the shoulder blades, okay? Again, I'm looking straight forward, right at you here. Squeeze the spine between the shoulder blades. And you hold that for 1 to 3 seconds and then let it relax. Okay, squeeze, and then you want to bring them down a little bit. So it's not up, okay? You don't want to bring those shoulders up towards your ears. You want to bring it straight back and down. That helps to bring that shoulder blade, again, back into a neutral position so that your shoulder is in a neutral position. Stronger shoulders, more stable shoulders will help prevent injuries down the road, okay? So the 5 exercises, usually you start with the circles to warm up, start small. Okay, one direction, other direction. Then the next one, the shoulder retraction. Bring the shoulders back. Okay, pull them back and down. Hold those 1 to 3 seconds. Then you have the middle deltoid or shoulder abduction, okay, or shoulder raises. And then you have front shoulder raises right out in front of you. Again, go about 90 degrees. You don't have to go above 90 degrees. You can do a hammer hold or hands facing down, okay? And then the posterior deltoid, you're leaning over something for stability, arms straight out to the side, slight elbow bend, and you should feel that right across the back part of the shoulder. People are going to ask a number of times, how often do we do this? Typically, 8 to 10 reps. If you start feeling a slight burn, that's about the time when you want to stop, okay? If you're going really, really lightweight and you're only using the weight of the arm, maybe up to 15 repetitions, but 3 sets of maybe 8 to 10 repetitions should be the amount that you need to really strengthen those shoulders. Just to give you an idea, I'm a pretty strong guy. I rarely go above 20 pounds when I'm doing these exercises. So again, if you're someone, 50, 60, 70, 80 years old working on these exercises, a lot of times simply using the weight of the arms to get the shoulders moving is all you need to help strengthen and stabilize the shoulder, okay? If you have any questions, do not hesitate to reach out to me by phone, calling my office, or email. And I'm Dr. Dan here with your shoulder exercises. Check out Turo Family Chiropractic. We'll see you next time. Thanks so much.